Okay, we are back. Much closer, much closer. There we go. Look at that. We are back at HIMSS 10 Day 3, and I am with Mark Morsch from A-Life Communications, A-Life Technologies,
A-LifeMedical.
A-LifeMedical. And this is a company that specializes in natural language processing. Tell our viewers a little bit about this.
A-LifeMedical is really the pioneer of computer-assisted coding and a developer of natural language processing. So computer-assisted coding is a technology which reads physician notes and applies rules to the outcome of the NLP and derives the CPT IC9 HICPIX codes.
Of course, of course, no, no. And actually, I don't know if that's great that I get some of that, but I when doctors are writing their charts or speaking their charts, your software comes and takes in and kind of converts that into stuff that's billable, right? The CPT
Yes.
codes and the ICD-9.
Yes. Yes, so natural language processing is the technology we use that can read the physician notes. So it's a technology that's been around kind of since the early stages of computer science, and now it's being applied very effectively in computer-assisted coding, but also other areas in data abstraction and data mining.
Yeah, and I've actually been involved with some of that work with Peter Elkin in New York, but it's really interesting stuff for research purposes, but I imagine what's driving a lot of this is more accurate billing. I think, as I understand it, that the dream has always been for a physician to simply write a paragraph about a patient encounter and for all of this information to get abstracted. And so a doctor says, oh, I had a patient that had, some pharyngitis. I examined the throat. I sent a strep culture, and I discharged the patient on amoxicillin. And all of that to somehow get encoded. Is that what your software does?
Yes, what our software is able to do is really accommodate the style of communication with a physician in a very natural way. So the physician doesn't have to adjust their documentation style to a particular EMR. They can create their documentation using natural speech, and whether that's transcribed or dictated or using speech recognition, our technology can then read the output and derive the structured data from it.
Okay, so instead of checking boxes about little procedures that were done or little questions that were asked or exam features that were noted, the physician has their own electronic medical record. No matter what they've already chosen, they get your service, A-Life, on top of their medical record to kind of abstract this information.
Yes, we're a software as a service model. It's a very simple model to use because we can work with their existing documentation system and then interface with their billing system to upload the appropriate codes for the claims.
Wow, okay. So do you work with clinicians in private practice, small groups, or do you work with hospitals or everything in between?
We work with a variety. We work with physician groups, we work with hospitals, we work with medical billing companies, and all sizes. We also work in both for the outpatient and inpatient settings.
Okay.
It's a very exciting field.
Yeah, and I know certainly for its research purposes and biosurveillance, I know that there's going to be a lot of applications for this, but I imagine also for billing. Anything from our chat room yet? Any commentary? Okay, Dr. Bell.
I wonder if you've had a special challenge with people whose first language isn't necessarily English. How do you code those kind of charts? I imagine that's difficult.
It can be a little bit of a challenge for that English as a second language. The accommodation usually has to be made more at the speech and transcription side of things. For our input, which is typically electronic text, it's usually been cleaned up to the point of we don't expect perfect syntax. We don't expect perfectly structured documents. So, and that's kind of the norm of medical documentation. So, with technology that's successful, with NLP technology that needs to be successful in medicine, you need to accommodate that variation both from different speakers and different documentation styles and different documentation types. So, all that's kind of needs to be accounted for in medical NLP.
How do you how do I guess are there keyword searches? Are there is it handwriting recognition or any of that, or is it voice recognition, or is it simply just trying to look at the proximity of certain words and understand what the doctor is trying to get at?
Well, we've been working on this technology since '96. So, A-Life was one of the early developers of NLP. We have a patented technology called LifeCode, which is kind of the brains behind our products. And it's really a combination of technologies which is able to recognize the lexical structure, the syntactic structure, and really understand the meaning of the documentation. So it's applies computational linguistic techniques. There's a couple different technologies that can be applied, rule-based technologies, statistical technologies. We use a hybrid approach to really maximize the performance.
I remember like when the Apple Newton first came out, there were some like funny transcripts of like mistaken interpretations and things like that. Do you have? I'm sure your software now is very advanced, but like maybe from the early days, were there any notable misfires or like miscommunications?
Sure, that's the kind of things you really want to avoid. You want to avoid giving folks conditions that they don't have, giving folks conditions that their mother has or that their aunt has, and that's kind of the areas that we focus on. And also, it's very important to build in auditing and the appropriate reviews into any workflow that incorporates this type of technology.
Is there any human supervision at the end of the day after a bunch of transcripts or a bunch of processing has occurred, like an overseer takes a look at things?
Yes, and that's that computer assistance means that the ultimate coder or abstractor can be far more productive in their work, and some of the codes can go directly into the billing system with minimal review, but certainly there's always needs to be a level of auditing to ensure compliance.